Welcome, please take your seat. We are pleased to welcome you all on behalf of the 4 co-host organizations. To those of you who have joined today, welcome. To those of you who were here yesterday, most of you, we hope you enjoyed the yesterday program, and we hope you had a good rest. Today, the main conference program will start. It will take place today and tomorrow. We have a very rich program, many speakers, and hopefully we will have a lot of good discussions. I should have said yesterday that your name tag is not an ordinary name tag. It has a QR code. So normally when you leave a conference, you put your name tag away. But I would encourage you to keep it, because the QR code takes you to the website of the conference. That website will live on. It will be a platform and a repository for material, slides, papers, and hopefully the network that we are trying to build. Should you lose the card, contact us and we will send you the link to the website. But welcome again. As I said, we have a very rich program in front of us. And we will start by inviting Bente Mikkelsen to the stage to give the official opening and welcoming remarks. Bente Mikkelsen was director of NCDs with the WHO Geneva until very recently, and she joined the World Diabetes Foundation Board of Directors a month ago. Bente, please, and a round of applause.
Thank you very much, Bent. Distinguished delegates and representatives of ministers of health and local authorities and representative of global and regional health agencies, their health experts, clinicians, researchers, advocates, and civil society representatives, their representatives of international organizations, philanthropies, and private sector, and I would emphasize their people with lived experience of type 1 diabetes. Colleagues and friends, welcome to Copenhagen and welcome to the international meeting on type 1 diabetes, held under the title, and please remember the title because that's what we are going to do, Advancing a Global Road for Improving and Integrating Care in Low-Resource Settings for Type 1 Diabetes. It's a very important task. I proudly welcome you on behalf of the 4 co-hosts and in my new capacity, very proud, being a member of the Board of Directors, WDF. So the 4 co-hosts is the World Diabetes Foundation, East Africa Diabetes Study Group, University of Geneva Faculty of Medicine, and the Danish Diabetes and Endocrine Academy. We are honored to have you all together here in Copenhagen for this important international meeting for the coming 2 days, and I think the sun will shine at least inside us. I also welcome all participants who are online. We have more than 500 registered. Welcome to you as well. I will now say things that you know, but I think we can use the time to sort of really think through them. Estimated at least 9 million people are living with type 1 diabetes globally, and with estimated more than 230,000 new cases diagnosed every year. These numbers are expected to rise. Without access to life-saving treatment, these people will lose their life. These people is at the highest risk during humanitarian crises and disasters. The cause to type 1 diabetes is not known. There are many theories, and we heard of some of them yesterday, some more funded than others. I want to emphasize that more research and data is needed. But we know and have known for many years how to diagnose and treat type 1 diabetes. Since type 1 diabetes cannot yet be cured, efficient care is life-saving. Efficient type 1 diabetes treatment and care is lifelong and involves the person living with diabetes, her family and friends, and every part of a health system. It requires trained healthcare professionals. It requires regular access to care and health facilities. It requires insulin and blood glucose testing devices. It requires education and self-care management skills. It requires psychosocial and focus on mental health and household support. It requires integrated services at all levels of the health system and financial protection through universal health coverage. Managing type 1 diabetes is a 24-hour job for the person living with, where you can never take a day off. Many of you here today understand this deeply from your own lived experiences. This meeting will address different aspects on how we will advance the agenda. While people with type 1 diabetes live longer and healthier lives than ever in some parts of the world, unfortunately, there is a huge inequity in the world and for people living with diabetes in low-resource settings and in humanitarian crisis, access to care can be insufficient, very often is. People with type 1 diabetes will suffer from severe complications and, sadly, die very prematurely. So, dear all participants, this is why we have gathered here. How can we make access to efficient diagnosis and care a reality for all people living with type 1 diabetes everywhere? In 2022, at the World Health Assembly, the first ever global coverage targets for diabetes were endorsed. The world set the goals that by 2030, 80% of people with diabetes are diagnosed, 80% of people with diagnosed diabetes have good control of glycemia, 80% of people with diagnosed diabetes have good control of blood pressure, 60% of people with diabetes of 40 years or older receive statins, and that by 2030, 100% of people with type 1 diabetes have access to affordable insulin and blood glucose self-monitoring. In 2021, we marked the century of discovery of insulin, and the WHO launched the Global Diabetes Compact, an unprecedented WHO-led initiative on diabetes, now with over 90 partners. Just think about it. At the time, it was 101 years since the discovery of insulin, and still at that time, only 50% of those in need actually got insulin. Is that an innovation? Is that how to work? Just think about it. The Global Diabetes Compact has the vision of ensuring that all people who are diagnosed with diabetes, including type 1 diabetes, have access to equitable, comprehensive, affordable, and quality treatment and care. The Global Diabetes Compact seeks to reduce inequity in access and that everybody can have access to what they need. The Global Diabetes Compact needs all hands on deck. Everyone has a role to play. It belongs to all who are engaged in the fight against diabetes and in the community to ensure access to care. Our colleagues from WHO who are here today with us will share more details and call upon your engagement. We have the Global Diabetes Compact, we have the global treatment coverage targets, we have the knowledge, and we have commitments from 194 member states of WHO actually stepping up for diabetes. We need to hold ourselves accountable. We also have other initiatives and important frameworks. The new Lancet Commission on type 1 diabetes, and those who are lucky and learned about this yesterday, this is really encouraging. So please take contact with those in charge, and you will learn about that. And we learned more also of initiatives like IADA seeking to focus more on reaching people with type 1 diabetes in emergencies. Thank you for doing that. all critical to our joint efforts. Research is key. There is a strong new WHO prioritized research agenda with more focus on access to care and on barriers to implementation of diabetes programs, but many more partners need to join the research agenda. We also need to explore new technologies and innovation. The potential might be even bigger than we think. A new digital tools for diagnostics and glucose monitoring should reach all parts of the world, not only high-income countries and not with the old technologies. What really matters to people with type 1 diabetes is the progress at country level, at community level, and at household level, where real lives are impacted every day. The global framework and policies need to be translated into action by national health authorities and stakeholders in co-creation with those with lived experience. Those who are working on the ground every day in health facilities, communities, and households need to get the support they require to improve care and lives of people with type 1 diabetes and have the necessary resources. Over the coming 2 days, at this international meeting on type 1 diabetes, we have a rare and very special opportunity to meet across sectors, geographies, and stakeholder groups, and with people with lived experience from many parts of the world, and share our knowledge, experience, best practices, and discuss challenges, barriers, and solutions. But most of all, we have the opportunity together to find the solutions for improved type 1 diabetes care, to build new alliances and collaboration, and give each other the hope that we can achieve the global targets set. We have the opportunity to have a Copenhagen call of action for diabetes type 1. I think it's the first time. I hope that you have been looking as much forward to this as I have, and I would like to congratulate you for coming here and really enjoy and put the best of your efforts into this meeting. Thank you very much.
Thank you, Bente, for those opening remarks. On behalf of the University of Geneva and our co-organizers, the World Diabetes Foundation, Danish Diabetes Academy, and the East African Diabetes Study Group, I would also like to welcome everyone here and hand over the next session, which is entitled Setting the Scene for Type 1 Diabetes, to my colleague Bent from the World Diabetes Foundation. Thank you.